Greetings from Delhi Medical Association and eMedi News. Welcome to our show, Chat with Dr. KK. We have with us Dr. Deep Goel, who is Director of Minimal Access Surgery and Bariatric Surgical Gastroenterology at BLK Super Speciality Hospital. Thanks to be in our show.
Thank you, sir.
We talk about in the year 2013. 2012 is gone. What's new in the field of bariatric surgery and obesity?
Sir, it's amazing how surgery can treat obesity and diabetes, especially in people who are obese. Even before patients start losing weight, their insulin requirement and the requirement for the drugs goes down drastically, and in 95% of patients they become off drugs.
That means the requirement of insulin, the oral drugs, hypertensive drugs, it will all go down.
All go down, sir, especially obstructive sleep apnea patients, diabetes, all this disappears completely.
So if I come back to the year 2013, clear-cut indications for bariatric surgery and obesity.
Anybody who has a BMI of more than 32 and has any of the medical diseases requires surgery. Anybody who has a BMI of more than 35, no illness, requires surgery.
That's on today.
That's
and suppose in diabetes?
Diabetes, sir, there are a lot of researches going on. Even people who are not obese, we can do this surgery, but still I would not say that it is the norm of the day.
Risk?
Risk is 1 or 2% as you have in any other surgery.
1 or 2% is very high.
1 or 2% is of morbidity, sir. Mortality is less than 1%.
Mortality is less than 1%.
Less than 1%, sir. And you have to see what are the morbidity and mortality of the disease which patient is having.
Now, what works in bariatric surgery? What works in bariatric surgery?
There is
the small size of the stomach?
That is one factor, sir. But there are a lot of neurohormonal changes which happen in the foregut. Today, our understanding of diabetes is not only insulin. There are a lot of other hormones which play a role in the gut, in the stomach and the small intestine.
If I do a medical bariatric surgery, that means I start giving a person 60 ml of food at a time and ask him not to take more than 60 ml, something like a medical bariatric surgery, will it work?
No, sir. Patient goes into ketosis. If you ask diabetic patient to go fasting.
No, I'm talking about obesity person.
It's not possible.
80 gram or 100 gram of food. Even now,
well,
after bariatric surgery, you are giving 60 ml only.
That's what I'm saying, sir. It's not only the restriction of food. It is also a lot of neurohormonal changes which are happening in the body, sir.
Okay. Anything else in the field of bariatric surgery?
No, I think that's what is happening today. It's in India now. It's becoming more popular. People are realizing its potential. People are getting aware of it. And as we know that our country is going to be the world capital of diabetes by 2025, as WHO tells us, I think this surgery is going to get more and more popular in times to come.
If you would not have been a doctor, what you would have become?
I can't think of anything else of myself being nothing more than the surgeon.
So it is not only your profession, it's your passion.
It's my passion.
It's your passion also. What about this so-called brutal gang rape, your reaction?
Well, I am just ashamed to say that I am a part of the same country where this is happening to women. And we all need to contribute to change the mindset of at least the next generation.
Do you feel that every PCR van must have a paramedic with them to provide the first aid?
Absolutely. Absolutely.
So what Dr. Deep clearly says is that if you are obese, not responding to medical treatment, if your BMI is more than 35 or more than 32 with comorbid conditions, have an option, go to your doctor and ask for, do I need a bariatric surgery? And that's all for today. Just thanks our
Thank you so much, sir.
Guest with us. We'll come back with one more show. Till that, goodbye. Thank you.